Okay, we're going to be talking about thyroid disease with hypothyroidism, Hashimoto's thyroiditis, Graves' thyroiditis. We're going to talk about what you can do to avoid these diseases. Here is a periodic table of the elements, and one can see the key row here is the halogens. Here's F for F minus, Cl, chloride, bromine, and iodine. In general, the halogens, halogen to make salt, they tend to be relatively toxic. Iodine is used as a prep agent on the skin. Chloroprep is used as a prep agent. Bromine is used as a flame retardant. F minus is used to sanitize water, for example, and for many other purposes. We've talked about that in a previous lecture. Okay, the major questions about hypothyroidism are what causes it. You always want to know what causes a disease. That's the most important thing, because if you know what causes it, then you can ask yourself, can the cause be avoided? Now, sometimes you can't avoid, the fact that you're a male or a female, for example, or the fact that you have some genetic condition. But the genetic diseases are really, really, really rare. There's this exaggerated thing that goes around in common parlance that genetic diseases are common. No, they're super rare. And even when they might increase vulnerability, usually it's a minor increase in vulnerability. I tell you that because believing something is genetic turns a person into a chump. I've seen tons of people with diabetes, hypertension, coronary artery disease say it's just genetic because it's in their family, or their cancer's in their family, and then their diseases really aren't genetic at all. All right, how to figure out what causes your diseases. Go look around at different websites or books or internet, but most books, websites, they stink, okay? They give you generic, wimpy info. A lot of times they're trying to sell a potion or get you to take drugs, so don't fall for that. What you want to look for is there any information that'll really help you. Maximum benefit, minimum risk. Try to get a free opinion from a doctor or a nutrition expert. It's better to get a free opinion if you can than a paid-for opinion if you can. Once you're plugged into the system, there's all kinds of obligations that you probably don't even know anything about. For example, if one doctor sends another patient to another doctor, that's called a referral. And the referral doctor must please the one who sent the referral, or they won't get any more referrals. So there's an obligation there. Also, a formal consultation then requires standard of care. And everybody thinks standard of care is good. Standard of care is the lowest common denominator for unconscious people, alcoholics, cognitive impaired people, all right? You want optimal care, not standard. Sometimes they're the same. A lot of times they're the same. But you always want optimal care. Think about that. Because, for example, I went around watching all these videos on thyroid disease and reading all about it, and almost none of them, literally not a single one, talked about what you could do other than, improve your diet, take this pill. Yeah, improve your diet is good advice, but trust me, you can do a lot better than that. And that's what we're going to try to do here. Type into your computer browser, what is the global distribution of this disease? We're talking about autoimmune diseases, so they're going to be northern, where it's colder, less sunshine, less vitamin D, more meat consumption, more dairy consumption, industrialized areas. That's the classic fit for autoimmune disease. And most thyroid disease is autoimmune disease with regard to hypo and hyperthyroidism. Always ask yourself, what other diseases do the patients get? If they got an increased incidence of other autoimmune diseases, then it's probably an autoimmune disease because they usually go together. Who gets it? Most common group to get autoimmune diseases is women between 25 and 65 years of age. Something to do with their estrogen, I believe, affecting their immune system, like when they're pregnant, because having a baby is like having a transplant. So it has a weird, almost schizophrenic effect, partly suppressive, but on the other hand, in some other ways, it can actually accentuate immune reactions. That's a complex subject, but it's just a fact. Women get more autoimmune diseases. Read about normal function of the thyroid. Always try to understand the organ system that you have a problem in so you can try to improve it. The hypothalamus makes TRH, thyrotropin releasing hormone. That's way up in the middle of the brain, and that goes down to the pituitary. Pituitary makes TSH, thyroid stimulating hormone, TSH. Then goes down to the thyroid. It's like the little butterfly thing in your neck there to make thyroid hormone, which increases metabolic rate, give you more energy. So in the old days, people talk about thyroid disease. There was an emphasis on the goiter belt and a lack of iodine causing the thyroid gland to enlarge to try to be better able to make thyroid hormone. That's not as much a problem nowadays because people tend to eat foods from all over the place, so there's going to probably be enough iodine in them. If you've got salt in the house, have it with iodine in there, but don't make sure there's no aluminum in your salt. A lot of times they put aluminum as an anti-caking agent in your salt. Okay, most common cause of hypothyroidism is Hashimoto's, which is autoimmune, and most autoimmune disease thought due to leaky gut. About 90% up to cause the hypothyroidism is Hashimoto's. Typical labs are going to find is high TSH because the thyroid's not able to do its job, so it cranks up the TSH saying, come on, do your job. Low T3 and T4, those are the thyroid hormones. And T4 is almost like a storage form of it that gets made into T3, the more active form. And you can see if those are low, it's what you'd expect with Hashimoto's. Increased TPO, tissue peroxidase autoantibody. It's the most common autoantibody with Hashimoto's, and that's related to the production of thyroid hormone. Also increased thyroglobulin autoantibodies. So those would be characteristic of making a more precise diagnosis of Hashimoto's. Hypothyroidism is about 5 times more common than hyperthyroidism. Graves, most common cause of hyper. It's often treated with radioiodine, which then causes hypothyroid. A lot of patients nowadays, too, are hypothyroid because they had surgery for their thyroid because they had the thyroid resected for thyroid nodules that were cancerous, for example. But, you know, like I said, the smart move is be like Adam and Eve with indoor heating and plumbing and, you know, be a minimalist. Trust me on that one. You think it's no big deal going to the doctor and getting all these tests. It's actually very dangerous. The reason is your doctor wants to help you, but your doctor is obligated to follow a whole bunch of rules and guidelines. And the guidelines always promote do more, do more, do more. And the doctors are all afraid of being sued. So there's going to be a strong tendency to overdiagnose and overtreat. All right? So if you got a real problem, you're not feeling well, go to the doctor. Maybe it'll help you out. But don't go running around looking for every new test in town because you will be diagnosed with a whole bunch of things, which probably will be false positives or exaggerated positives, and you'll get some treatments that have very real consequences. Look at me. I have friends in every field. I don't go for anything. I don't take any pills. I just try to keep myself healthy. What I imitate is the centenarians, and they don't ever go to a doctor. They're 105 with no problems. That's what you want to try to be like one of those centenarians with a good mellow personality, hardworking, energetic, but not hypochondriacs, not at all, okay? McDougall says he believes that in some of the meat foods, like a hot dog, they just grind up the animal like in a blender, and it contains pieces of thyroid proteins, and the person forms autoantibodies to that when they've got leaky gut, and then it cross-reacts, those antibodies to the animal thyroid cross-react to your own thyroid. Okay, some miscellaneous thoughts here. Okay, well, I meant this is supposed to be leaky gut. I mislabeled the slide. I was in a hurry making this lecture here. Here's the point. These are a bunch of things that cause leaky gut. Now, why am I emphasizing this? Because leaky gut is the most common cause of autoimmune disease, and I can't believe it. Go around the internet, watch a whole bunch of videos on thyroid, and you probably won't even see a single one talking about leaky gut. It's the most important thing you can know. This is how you have the chance to potentially cure yourself if you catch it early. Once the thyroid's gone, then you're stuck. You're going to have to take the thyroxine, levothyroxine medicine. But if you can catch it early, you might be able to save your thyroid before it's too late, just like you try to save your pancreas before it's too late with diabetes so you don't end up dependent on insulin. Okay, saturated fat, it's amphiphilic. You got the carboxylic acid being polar, then you got the nonpolar fatty acid tail of carbons and hydrogens, and they're able to intercalate with the plasma membrane of the intestinal lining and cause leaky gut. All right? Also, it includes dairy, not one drop of dairy, not one bite of meat. And you have to be a stickler for this, okay? If you want to be a wimpy, everything in moderation, go to some other website. Mine is for intelligent, motivated people that really want to get well, all right? And I'm just going to tell you the truth. You can take it or leave it. No meat. Like an alcoholic can't have one sip of alcohol, okay? No dairy, not one drop, okay? If you really want to get well, and people say, well, why am I such a stickler? Because I want to see you get well. You got to remember, all day long I see people crashing, burning, and dying, and they're screwed, and they never get better. It's sad. And so this is a chance to get better so you don't have to end up like that. Oils, no oils, not one drop. I made tons of videos about that. It should be obvious by now if you studied it. Oils are major toxic, okay? Olive oil too, they're all bad. Okay, emulsifiers. Emulsifiers are very similar to fatty acids. Again, they're amphiphilic, like an amphibian can live on water and land. They got a polar side and a non-polar side, and they can induce leaky gut within the intestinal lining. Intestinal lining is called it's called the enteric tract. The lining cells are called enterocytes. You can more specifically label the colon lining cells, colonocytes, for example. Processed foods always have emulsifiers. Emulsifiers, again, can be part aqueous solution, part hydrophobic solution, oily fat solution, such that they can get things to all stick together within a processed food, which is going to be a combination of sugar and fat. Typical sugars are made from corn, like high fructose corn syrup in a processed food. The typical protein comes from GMO corn. Don't ever eat that stuff, never. Okay, antibiotics. They'll kill the good gut bacteria, which help make the short-chain fatty acids in the colon that the colonocytes use to maintain the tight junction, prevent leaky gut. So if you wipe out the good gut bacteria with an antibiotic, then you're at increased risk to get leaky gut. And then what a lot of people don't realize is GP, glyphosate, which is in non-organic foods, very many of them, it was originally an antibiotic. Okay, it wipes out your good intestinal bacteria and increases your risk of getting leaky gut. It can also deplete the gut bacteria of, through the pathway, blocking the shikimate pathway of tyrosine. And tyrosine is a precursor for thyroid hormone. So it can cause thyroid problems in two ways: by depleting the good gut bacteria, dropping your tyrosine, and also by inducing leaky gut effect. Alcohol, you prep the skin with alcohol to kill bacteria. You don't want to be, it's not that simple, but you don't want to be drinking any alcohol. Keep it as low as possible. I don't believe any drinks are good. We've talked about that before, the sick quitter effect. Alcohol is not good for you. I recommend zero alcohol. All right, excess sodium. And by the way, just to give you an example of this, when I was young, we all go through young love. I was in love with this girl, and her mom was sick, and her mom had lupus, and she wanted me to try to help her mom, and I didn't know anything when I was a young student. And I just said, go to the expert specialist, which she did, and she had a terrible outcome, a heart attack, a stroke, and she died. And I felt bad because I wasn't able to help her, okay? It wasn't until, decades later I knew enough that I might have been able to help her, okay? So that's how important it is to know this type of stuff. People you care about, you love, will die if you don't know this stuff. And it's easy to learn. This is not, complex stuff, okay? Excess sodium, this is a minor concern, but theoretically it might increase autoimmune disease by accentuating T-cell reactions. That's a minor thing. It's not one of the major players. The major players is the stuff up here. No animal products, no oil, no processed food, no antibiotics to the extent you can avoid them, which especially means avoiding non-organic food. Okay, oral contraceptives, increasing estrogen levels, seems to have a little bit of an effect. Estrogenic chemicals. The big lady who wrote about this, let me show you her book. This is actually quite a good book. Let's see if I can get it in there. Endocrine Disruption and Human Health by Philippa Darby. She's a United Kingdom PhD scientist. She's done a lot of great work on figuring out all these endocrine chemicals. She's the one that did a lot of work to figure out that aluminum and estrogenic preservatives and deodorants were associated with increased risk of breast cancer. So she's good for that. Okay, next slide here. What causes leaky gut going on? Dishwasher soap. Soaps, again, are detergent-like, meaning that they're amphiphilic. Hydrophilic and hydrophobic in the same molecule, and they can pull hydrophobic stuff into aqueous water-like solution. Avoid that stuff. I rinse my dish off when it comes out of the dishwasher, okay? And like I said, I got plenty of people and family and friends who will tease me about all these little idiosyncratic habits, but you know what? I'm aging so much better than them, I just laugh at them. I say, okay, go ahead. If I wanted to be fat and stupid, I would be like you, but I don't, so I'm going to do all my little habits. Okay, non-stick cookware. I don't know how important this is, but there's, F- in there, so it's recommended to avoid that. Most plant-based stuff, we don't need to get into all that now. NSAIDs. Avoid. They tend to increase risk of leaky gut. Lithium and amiodarone are two meds that can sometimes be associated with increased risk of hypothyroidism. High fructose corn syrup can cause leaky gut. I don't remember the exact mechanism. Leaky gums and poor dentition. Yeah, if you have, just like a bacteria, toxic bacteria and protein material can get access to your blood if you have a leaky gut. If you got leaky gums, poor dentition, it can get in there too. So we got separate lectures on how to take care of your teeth. F- is antibacterial. It inhibits a whole bunch of things. It inhibits enolase enzyme in glycolysis. It inhibits 3 different enzymes in Krebs cycle. It inhibits The electron transport oxidative phosphorylation pathway, you don't want it there. Okay, you don't want it in your water. You can remove it with reverse osmosis. Best option is to go to a place where you got well water with no fracking in the area. Test the water first. That's the best you're going to do. And I also like a whole house carbon filter. Get the chlorine out too. They're both halogens. So I would like those removed if possible. Excessive psychological stress, that can contribute to leaky gut. It's not the major player, but it can contribute to it. Stress equivalents, caffeine, lack of sleep, corticosteroid meds. Okay, fine. Gluten problems, avoid the modern wheat. I know ancestrally wheat was a major, good starch, but nowadays it's processed and there's a lot of variants of it that have been modified. I don't know exactly how, but you don't need it. I used to eat bread, but I don't eat bread anymore because I went to the grocery store, including the grocery stores that put bread in the refrigerator, which tend to be better breads, but they still stink. They all had oil in them or MSG. Most of them had MSG and oil plus a whole bunch of other things. Most of the bread should automatically be disqualified because you just see them. They can sit there for years. You look at their expiration date on the package. It'll be like a year later. You don't want any of that, okay? So you might have to be gluten-free. It's kind of easy to be gluten-free, though, if you're a vegan because, oats and quinoa are grains that can be very low or absent for gluten. So look into that. Forget about the phosphoric acid and carbonated beverages. You don't want those. Amalgams. I've heard different people say that mercury Hg is significant. Hot liquids might melt some off the top. I don't know if that's really true, but I've heard that. I've heard chewing hard foods might cause a little bit to dislodge from there. Again, I don't know for sure if that's true, but do I avoid both those things? I don't drink anything hot because I don't like hot stuff. I'm talking about temperature, not spiciness. And I don't like necessarily chewing them, even though I used to eat carrots. I don't eat them anymore, but I still think they're great food. What about the claim that Hg can decrease iodine uptake into the thyroid? Oh, there's some claims that it can do that. Other spots for Hg, hair dyes will sometimes contain them, thimerosal and contact lenses, for example. Titanium dioxide, I've heard different things about that. I'm not sure. If I was at risk for an autoimmune disease, I would avoid it, though. I avoid it anyways, but artificial sweeteners are thought to also increase a risk of problem. Tea maybe concentrates F-. Colon cleanse enema, I heard some people do that. I don't know. That doesn't sound like such a great idea to me. You're going to lose all your good gut bacteria. It might have taken you a while to get them. You can get them right back, just eat healthy food, but I don't know. I never was too enthusiastic about that kind of stuff. Avoid soy. It's goiterogenic, certainly in animals, and there's some experts who say it's not that big of a deal in humans, but if you're trying to get better, I would say why take a chance? I would avoid it. I got two other lectures on that subject. Cruciferous vegetables, a lot of experts say it's no big deal. You could eat them. It was a little bit of an iodine competition for absorption thing in the gut, and it's a minor thing. So it probably is a minor thing. Cruciferous vegetables, because they've got a cross-shaped leaves on them. That's why they're called that. These are kind of like minor issues in this whole game of preventing leaky gut. Avoid bromine. And that's, for example, like for any physicians out there, if you need to wear a blue surgical gown because you're working in the operating room with cautery, great, fine. But if you're just doing some minor bedside procedure like stitch removal, I would choose some gown that's not going to have the bromine flame retardants on it like the blue ones, a yellow gown, a white gown, something that, why expose yourself to bromine for no reason? All right, head trauma associated with increased risk of pituitary hypothyroidism. Pretty rare, but that could happen. Okay, rationale and hope. There are a lot of people who have resolved their autoimmune disease. You go to drmcdougall.com site, it'll give you tons of testimonials. Kempner used to write about his patients with autoimmune disease who got better, especially he wrote a paper, I remember it, on psoriasis. Stari Stanchek, she's a lady doctor, feisty lady who at first felt consigned to a lifetime of powerful medications, and then she started studying MS and she realized, gee, in the twin studies, they don't usually both get it. It's not genetic, okay? Diet is a huge component. It's not primarily genetic. Roy Swank, I saw the Norway patients in the dairy areas having much worse MS, so he put his patients on no dairy and lowered their fat intakes, and he's got the best results of anyone in the world, by far, from dietary approach to multiple sclerosis. At 34 years, 95% of his patients were intact for ADLs, activities of daily living. That's extraordinary, by the way. Get your sunshine. You always get the sunshine. That's better than taking any pill for your vitamin D. Some doctors recommend Brazil nuts to one a day to get selenium, but you can get selenium from other foods. I don't think you need to do that. And the Brazil nuts can have a lot of fat, but just so you know, some people say that. Selenium is associated with making your normal thyroid hormones. Typical treatment for hypothyroid patient is will end up taking levothyroxine, synthetic T4 hormone, and which can get made into T3 automatically. Be careful with these seaweeds because a lot of them might have contaminants. If you're trying to look for an iodine source, just be careful that you pick one that's not going to have a bunch of contaminants if you have to go down that route, if it's even necessary. Okay, so here's just a couple of references. This book's about GP. So anyways, hope that was helpful.